Heroin Rehab Centers provide effective treatment and support for addiction to heroin. A quality heroin addiction treatment program will offer a variety of residential or inpatient options as well as support for detox. Before we discuss the specifics of heroin rehab centers and what options are available, let's talk about the drug itself and why it's extremely important to get help today if you or a loved one is suffering from addiction. Heroin is a type of opioid drug that comes from synthesizing morphine. Morphine is a substance that is naturally occurring and is extracted from the seed pods of poppy plants. Heroin is usually a white or brown powder, or it's a black sticky substance known as black tar heroin. According to the National Institute on Drug Abuse, in 2011, 4.2 million Americans aged 12 and older had used heroin at least once in their lives. It is estimated that about 23% of individuals who use heroin become dependent on it. Heroin can be smoked, which is often called chasing the dragon. It can be snorted or injected. All three methods of taking the drug can affect the brain very rapidly. It causes changes in the brain and can cause a person to seek out the drug no matter what the consequences are. When heroin enters the brain, it's converted back into morphine and binds to the opioid receptors. This affects the perception of pleasure and pain. These opioid receptors are located throughout the brain, even in the brain stem, which controls such things as blood pressure, breathing, and arousal. In fact, heroin overdoses usually involve the suppression of breathing, which can kill you. When a person injects heroin, they will feel an initial rush or euphoria along with the heavy feelings of arms and legs, a flushing of their skin, a dry mouth, and clouded thinking. After this rush, there is an alternating between drowsy and wakeful states, known as being on the nod. When a person uses heroin on a regular basis, their brain function actually changes. Tolerance occurs, where more and more of the drug is required in order to feel the same effects. Dependence also occurs, where there's a need to keep taking the drug to avoid the withdrawal symptoms. There are a number of serious health conditions related to heroin abuse, including death from overdose, spontaneous abortion, and diseases like HIV and hepatitis. Someone who uses heroin chronically may develop collapsed veins, abscesses, gastrointestinal problems, infections around the heart, liver or kidney disease, and pneumonia. Street heroin is often mixed or cut with other contaminants or additives that can obstruct blood vessels leading to vital organs, as if the drug itself wasn't enough. One can see how heroin rehab centers can actually save lives. Let's discuss the signs and symptoms of heroin abuse. Heroin creates an effect that induces, quite rapidly, the feeling of euphoria and relaxation. Similar to other opiates, heroin blocks the ability of the brain to recognize pain. So for those who are experiencing some type of chronic pain, heroin may actually seem like a wonder drug. Those that are heroin abusers, especially if they have a history of prior drug abuse, may actually be able to hide the signs and symptoms of heroin use for a while. Anyone close to a heroin user, like loved ones, friends, and coworkers, might actually notice some signs of heroin use, especially right after they've taken the drug. These might include sudden changes in behavior or actions, disorientation, shortness of breath, constricted or small pupils, dry mouth. They're droopy looking, as if their extremities are heavy. They have times of hyperalertness, followed by quickly nodding off. Now, these signs are not necessarily unique to the use of heroin. The most obvious warning signs include the possession of items that are used to prepare and then to either inject, inhale, or smoke heroin. Some of these items are needles or syringes that are not used for other medical reasons, gum wrappers or aluminum foil with burn marks, burned spoons, straws with burn marks, missing shoelaces. These are used to tie off injection sites, water pipes or other pipes, small plastic bags with white powdery residue. We might notice a change in a person's behavior. Some of these behavioral indicators of heroin use might include the person no longer seems interested in hobbies and favorite activities. There's an increase in slurred, garbled, or incoherent speech. They are lying, or there's other deceptive behavior. Hostility towards loved ones. Withdrawal from family and friends. Instead, they might be spending time with new friends that they don't seem to have any ties with. There's a significant increase in their time spent sleeping. Unusual avoidance of eye contact or a distant field of vision. Stealing or borrowing money from loved ones or valuables that are missing. Wearing long pants or long sleeves to hide needle marks, even if it's warm outside. They care less and less about hygiene and physical appearance. Sudden drop in performance at school or work. They might seem to have less self-esteem or a worsening body image. Loss of motivation and apathy towards future goals. Those who use heroin will eventually build up a tolerance to the drug, which causes them to use more and more often. As the tolerance grows, more physical symptoms of heroin abuse and addiction start to show up. Needle marks or tracks visible on the arms. Sudden weight loss. Women might stop having their menstrual cycle. Unexplained runny nose. Scabs, cuts, or bruises from picking at the skin. Infections or abscesses at injection sites. There are a variety of treatment options available for heroin addiction, like Heroin Rehab Centers. Some types of treatment are more effective than others. One fact that is widely accepted is that treatment is generally more effective when the heroin abuse is identified early on. Although behavioral and pharmaceutical treatments can both be useful when used alone, science and research has shown us that the combination of both types of treatments will ultimately have the greatest success. On the pharmaceutical side, methadone is probably one of the most well-known treatments for opiate addiction. Methadone itself is a synthetic opiate that can help block the effects of heroin and the withdrawal symptoms. Because methadone has its own addictive qualities, there have been new drugs created that are quickly becoming more popular than methadone for use in heroin treatment. A combination drug, buprenorphine and naloxone, commonly known as Suboxone, is a recent addition to the list of medications now available for treating heroin addiction. Suboxone is different from methadone in that it offers less risk of addiction, meaning it produces a lower level of physical dependence. So patients who discontinue the medication generally have fewer withdrawal symptoms than those who stop taking methadone, and it can be prescribed in the privacy of a doctor's office. Suboxone is used in the part of heroin recovery process called detoxification. Even though heroin withdrawal is rarely fatal, the intense withdrawal symptoms that are experienced in the first week after the last drug use can be excruciating. This is why the use of medication like Suboxone is important. In fact, the primary purpose of detox is to relieve the withdrawal symptoms associated with stopping the use of heroin. While detox itself isn't a treatment for heroin addiction, it is an important step when it leads to treatment in long-term heroin rehab centers. According to the National Institute on Drug Abuse, the best drug addiction treatment is usually found in the residential programs that last anywhere from 3 to 6 months. As discussed earlier, medication is only one part of successful recovery from heroin addiction. Behavior therapy treatments are equally, if not more important for long-term recovery. There are many types of behavioral treatments available for heroin addiction. These might involve either residential or inpatient or outpatient approaches. Even though long-term residential programs have been shown to be more effective, they might not necessarily meet the needs of everyone. It's important to research the options to determine what's best for the addict. The type of behavioral therapy most often used is called cognitive behavioral therapy. It is designed to help modify the person's behaviors and expectations related to their heroin use. It will also help to improve coping skills when confronted with various life stressors. Technology-based treatments are becoming more common, like the use of neurofeedback, for helping the person to restore a degree of normalcy to brain function and behavior. In fact, if there are heroin rehab centers that are not using neurofeedback in their programs, they are doing a great disservice to their clients. Quality heroin rehab centers will understand both the power of the heroin drug itself, along with the fear and anxiety that go along with facing the emotions and life experiences which are at the root of the heroin use. They will recognize the uniqueness of each individual and will design a treatment program that best meets the client's needs. They will use the most successful tools and therapies based on the latest scientific research. Whether you are the one struggling with heroin addiction or it's someone you know, a loved one or a friend, it's important that you take steps today to research heroin rehab centers. Find one that meets your needs. We highly recommend the treatment center linked to in the description of this video for men who are ages 18 to 35. If that doesn't apply, call them anyway for a referral to a program that fits your requirements.